And then let's just talk briefly about, if you're not pre-printing, let's make sure everyone knows how to do chairside pickups. So this was an immediate here for number 8. Putting a long implant in, trying to get a bunch of bite, apically. This was the patient's existing crown. So, common, broke off number 9 or number 8. And I cut the root off of the crown and then drilled through the back of the crown and then put it's a really thin area, but here's your analog, and then put a cylinder on the analog, and that cylinder goes up through the crown, and then you can bond on the crown onto the cylinder. You can get kind of that S-shape idea here. So on that facial, make sure this is concave right there. And then you can see there's the tooth just put on. So again, this was a chair-side conversion there. She's going to heal in a temporary. You always want to leave it a little out of occlusion. And you always like to see when that gingival margin is actually lower than the neighboring tooth, so that you feel pretty good about, a little bit of natural recession is going to be okay. Here's a kind of a cool indication. So this patient came to me, and I didn't place these implants, but he came in with the implants already placed. They were integrated. Obviously, really big implants for the area, but they were fine. They looked good, but they were under the tissue. They were completely buried. He had a flipper up there. He had it for a long time. And he needed a full mouth rehab. Like, he needed every tooth in the mouth crowned, and then we were going to make him this bridge. So we took a scan on him, and then I took the scan and I lined up digital implants over his existing implants. So just like you add an implant in Blue Sky, you can go add a digital implant over his existing implants, and then you can put these long abutments on there. But what it really allows you to do is to see, okay, I did this digital wax up for him because I'm going to crown all his teeth, but I wanted to see where the screw hole accesses were coming on his wax up, right? Because you have no idea what's under there. You don't know if they're coming out the front, out the back. Can I screw retain? Can I not? And so, I got to learn, just be like, okay, once I open it up, I'm going to have, good screw hole accesses here, but this one's going to be coming out the facial. So I printed you can see that one's coming out the facial, and then the other two are okay. So I learned that basically I pre-printed a temporary 6-unit bridge, and then I exposed the implants, put on 3 temporary cylinders, and then had that pre-printed bridge already had the holes in it right where I knew that the angulation of those implants were going to come out. So it was very predictable to know where they were going to be. So there's just teeth just all around. It was all jacked up, and we ended up crowning all his teeth, and then it's all jacked. So, but here's look where the holes are, how they just lined up right where my printed temp was. So printed temp was made beforehand, and I just picked up those cylinders. And then notice how I cut off the hexes on there, because if you think about it, it's a bridge, and I want to screw retain this thing, you got to cut the hexes off, otherwise it's not going to drop in. What I did was I did that pickup, right? I picked up the cylinders, and then I put, if you look at, I put cotton tip applicators straight in there, and then I just did flowable around it. And the cotton tip applicators just held a nice little screw channel, so you get a really small little screwdriver access right through the top. I cut the hexes off, just flapped them open, and then screwed this temporary on. And I moved all the keratinized tissue to the buccal, and then we put them in temps, based off of our wax up there. So here's that S curve that we're talking about here on the facial. Tried to pull this canine into place. I couldn't get it, so I said, screw it, let's put an implant in there. So this was a cool case, because we pulled their canine, and it was like this huge defect in there with their canine, and we guided the implant right into that position, and it's just barely hanging in bone, and but it integrated good. But it's interesting. No, you really got to learn what to look for on these conical connections, because here's her temporary screwed down. You have to learn to be able to see that this isn't seated all the way. It's impinging right here. You got to look for this little gap right there and right there, because this is what it's supposed to look like. Like, you shouldn't see any gap. It should just be white to white. But here you can see the outline. It's not seated all the way. So we did the same thing. That's a chair side conversion there. Yeah, another cool case. Thin bone that we planned it coming kind of through the lingual. We still wanted to try to get it screw retained. So literally there was the threads sticking out. We planned it so that the apical threads are sticking out that concavity up there. And then we grafted the bone. We just did a strap, like a membrane strap over it. And then that was at time of placement on the left. Then it was integrated. This is what she came back with, and so that the buccal bone actually worked on this case. Sometimes they don't. It's hard to do. But this was a good outcome. Put the cylinder on. So here's our profile pin here, like we're talking about. Really profile that bone. So you can see that once it's profiled, you can get your parts all the way down. But notice what I did here. If you can see the cylinder, see this big lip right here? I ground that off, and so that's right there. So think about those narrow necks, because sometimes those lips are just so abrupt. And that's kind of like what we were talking about. This was just all flowable. I just bulked this thing up with flowable, and then take it off, and then you backfill it and clean it up. Back to the profile generators, the same kind of concept. This was a couple immediates, a molar and a premolar. I did this one with the surgical guide, resin, which works good too, because hey, you're already printing a surgical guide. Just go print it at the same time, and you can print a custom healer too. So I did this one was actually custom made for this patient. There's what it looks like when you take it off, so it healed up. Here's what it looks like when you take it off. This one was kind of a cool concept. There's no tie base on this one. I tried a concept where this little connection actually goes right into the implant itself, and the screw is just holding this in. Just playing with some ideas. That's what it looked like in the mouth, and not something that's like an everyday thing, but just kind of playing with some ideas.